Hi everyone, welcome to the Vision Refocus channel. I'm Dr. Kevin Cornwell.
And I'm Dr. Kristen White.
And today we're going to be talking to you about how diabetes and high blood sugar can affect your eyes and potentially lead to blindness.
Seeing as diabetes is the leading cause of blindness in adults under age 65, we wanted to put this video together to explain what's going on behind the scenes for those with diabetes.
All right, here we go. All right, so let's get into it. Basically, diabetes can affect each and every structure within the eye. So we'll start at the front with the cornea. This is the clear covering of the front of the eye. And very similar to how patients with diabetes can have compromised nerve endings in their legs, in their feet, in their toes, causing neuropathy, this same phenomenon can also happen in the cornea here. And this can lead to more severe symptoms of dry eye, recurrent eye infections, as well as delayed healing time after surgeries such as cataract surgery or LASIK.
So diabetes can also affect the lens inside the eye. Many of you may have noticed that when your blood sugar gets high, your vision temporarily gets blurry. This is due to excess sugar causing the lens inside the eye to swell. When that lens swells, it causes a large change in glasses prescription. Sometimes that change can last for up to a few months until your blood sugar returns to normal consistently. This swelling in the lens can also lead to premature cataracts and is the reason why people with diabetes often need cataract surgery at a younger age than people who don't have diabetes.
All right, so now we'll move to the back of the eye and take a look at the retina. This is the inside lining of the eye responsible for our vision. And over prolonged periods of elevated blood sugar, the blood vessels back here become weak and break down and become leaky in a process referred to as diabetic retinopathy. And the crazy thing about diabetes is that there can be a significant amount of bleeding in the retina here in the back of the eye, and patients can be relatively asymptomatic. They could be months, weeks, or even days from going blind and completely losing their vision. And unless the macula is affected, which is the part of our retina that is responsible for our central vision, patients can have no symptoms whatsoever, which is really scary. And so that's why we recommend getting your eyes checked on an annual basis if there's any concern for type 1 diabetes, type 2 diabetes, or even borderline blood sugar problems.
When the bleeding and swelling affects the macula or the central vision area, this can lead to sudden blurriness or distorted vision. This is called diabetic macular edema and often becomes a chronic problem. When someone has high blood sugar, it means that the red blood cells are carrying sugar instead of oxygen and other nutrients. This is the same process that can cause people with diabetes to have damage to other organs, such as their kidneys. When the eye doesn't get enough oxygen, it grows new blood vessels in an attempt to provide more oxygen and nutrients to the eye. This process is called neovascularization. And while this may sound great in theory, these new blood vessels are very weak and they grow along a fibrous network that actually causes traction and pulls on the retina, causing a retinal detachment and even blindness.
All right, let's take a moment and move back to the front of the eye and take a look at the iris. This is the muscle that makes up the colored part of our eye. And where the iris meets the white part of our eye, there's actually a drainage structure inside there. And due to the lack of oxygen inside the eye from uncontrolled diabetes, new blood vessels can actually grow over the iris muscle and clog up the drainage structures inside the eye here. And this can cause a rapid increase in eye pressure. And a lot of times patients can lose vision and go permanently blind within a matter of days to weeks in a condition called Neovascular Glaucoma. So we hope you now have a better understanding of how diabetes can affect your eyes and vision. Because many of these early changes may not cause any symptoms with your eyesight, it is important to have a complete dilated eye exam at least once per year.
The good news is that your risk for many of these complications is significantly reduced with healthy lifestyle changes to better manage your blood sugar. See the link in the description below for our video on our top 3 lifestyle tips to better manage your blood sugar and prevent blindness from diabetes.
And for more videos about diabetes in the eye, check out the other videos on our channel and consider subscribing. And we will see you in the next video. Thank you.